Thank you very much. I was invited to speak here over a year ago by Homan, and I said to him, this is a very bad time for me, the end of January. He said to me, well, the audience is really great at USC. You'll really like the audience. I said, I know, but January is a tough time for me. I'm first coming back after Christmas vacation, and, the students are coming back from school. And he said to me, well, we have great speakers, like David Cochran. And I said, yeah, but he says, and I'll put David on just before you. So, I usually like that because David primes the audience for me, So I said, well, maybe, but still, it's a tough time. So then he got me. He says to me, listen, why do you want to be in New York at the end of January when it's usually rainy all the time and, and cool? And he said, come to LA because, we've got great weather at this time. So I said, that was the deciding factor. I said, great weather, I'm here. Anyway, my topic for today, let's see if I can get this onto the screen, which I don't seem to be able to. There we go. Okay. Hope that's clear for you. All right, my topic for today is going to be the expanded use of narrow diameter implants. And what I'd like to do is to present this in light of the overall theme of this symposium, which is minimally invasive interventions. Now, back in 1984-85, when I began placing implants, we were told that the brand mark protocol was inviolable. You had to follow it. You had to wait 6 months post-extraction. You had to use operating room sterility. Implants had to be placed and submerged at least 4 to 6 months. You had to use non-loaded implants for 4 to 6 months. And the narrowest diameter implant allowable was 3.75 millimeters. Now, since that time, implant companies have found certainly that there's a need for wider and more and even narrower implants than that 3.75.